Hello everyone, our dear viewers from wherever you're watching us from. Before you, this is Madeko Marvin, your community health officer, specialized in preventive and promotive healthcare. We are in the month of May. Month of May is a World Mental Health Month, and it's a very important month. So we are here today. We want to talk about mental health issues that have been affecting us. Sometimes we know them, other times we don't know them. I'll be your host today, and here we're coming up from Set of Media. With me, I have daktari Edward. Is Edward Wakoli. I want him to just take 1 minute to tell us who Dr. Edward Wakoli is.
Edward Wakoli is a clinical officer who is specialized in orthopedics and surgery. He's working at Webuye County Hospital and also is working at KMTC Webuye as a lecturer.
So thank you so much, Daktari. I know you are a clinician, and before you went to specialize into orthopedics, you have come across a number of mental health issues. And surprisingly, wakati tulikuwa tukikuja hapa tukiwa kwa barabara, uliona kuna kijana alikuwa kwa barabara tu na kwa njia barabara, gari inakuja na mpigia honi. Lakini asikii, mpaka gari ilikuwa imkaribia sana, mpaka tumwambia wewe bwana utagonga na gari, na akashtuka. What do you think this was? When we start from there?
Actually, this a mental health month, and actually the guy we saw, this guy was some kind of depression. You see a man walking on the road, and this guy is just talking to himself. He is not even aware that the vehicle is coming. So the moment the car hoots, this guy jumps from the road and goes to the other side of the road. So this is a mental issue.
Now unajua sometimes afadhali tu yule sasa aliruka akaenda on the far side of the road. Unajua kuna wengine wanashtukanga mpaka niye katikati ya barabara ndio wanagongwa kabisa.
Huyu atakongwa.
I was just looking at statistics posted by IEPSOS. Yes. It was published last year, 2025. Yes. It shows that mental health is now the world's top health concern. And they have underscored that mental health has overtaken cancer as the world's most cited health concern in the global IPSS survey, rising from 27% in 2018 to 45% in 2024 by respondents in 31 countries. Imagine, mental health is at 45%, followed by cancer at 38%. What does this figure speak to us?
Actually, these figures are true. We have a lot of mental cases in the world, and most of them they go unnoticed. What we need to do is that we need to pull up our socks so that we can be able to get these mental cases in our communities. For instance, you will find that most of even our health facilities, they don't even offer mental health services. Okay, this is a challenge that we are having. So we need to set from home. We need to get these people from our communities. After that, we need to now to take it to our health facilities so that we can be able to have these services being offered in all our health facilities around.
Yes, you can see that's alarming. Watu walikuwa naogopa cancer, wanasema cancer is the deadliest. But when you look at mental health issues rise up from 27 to 45%, that's quite alarming. And as you can see, we have so many concerns. Maybe some mtu anashanga, oh, you are not a mental health case. How can somebody know that? How can we help somebody, or how can somebody recognize that this is a mental health issue? Because this month of awareness, sometimes kitambo ulikuwa unaona mtu akianza kuongea peke yake, the next thing you are going to see, they are going to call the pastor. Waenda fukuze mapepo. How can we help somebody who is listening to us from wherever they are know that now this is becoming a mental health issue?
Okay, mental health issues, we need to know how we can be able to identify this kind of people in our community, wherever where we are staying. The first thing we need to, if you see somebody who is stressed, these people who are stressed, that is a mental case. If you see somebody who is having, like you see a person on the road, like the one you saw when you were coming to the shop, these guys, when you saw somebody talking to himself or herself, these people who are sometimes they isolate themselves, they don't want to be, we call it, they are not social. They don't want to see
withdraw.
They withdraw from other people. So they are having their own things that they want to tackle for themselves and are unable to tackle them. So what we want is that we need to identify these people as early as possible so that we can be able to help them. And we need to take them to the hospital so that they can, if there's any investigations to be carried out, can be carried out, and then we set them on medication as early as possible before it becomes worse.
Yes, I know we are starting, and we'll be looking into details as the show continues, because we have dedicated all of this month to bring this knowledge to our viewers who are watching from the local or the global context. Daktari, there is an increase in 2018. Mental health prevalence rate was at 27%. In 2024, mental health prevalence has rose to 45%. What are these prevailing circumstances that are predisposing people to this mental health crisis? Because it's not normal. Shooting from 27 to 45% is quite alarming.
Okay, thank you so much. I think what is the most thing that we need to look at is like the economic status of the current economic status that we are having. You see, when somebody is not able to raise a meal in a day, this is a person who will be depressed, will have stress. You'll find that even these guys are the people who will even decide to take their life. They'll want to commit suicide. So these figures are right. What we need to do is we identify these guys, and then we set medication immediately.
Yeah, this is quite interesting, because maybe the change in economic status are contributing to these factors. And you have talked about a very important manifestation of mental health issues. Recently, even the president of the country, Dr. William Ruto, had to make a very special commission to investigate the issues to do with femicides. Could this also be a cause as a result of mental health issue? Because you look at the number of homicides, men killing women, husband killing wife, or husband killing wife and children, then kill himself. They are on the rise. They're on the rise, and they're all over. Could this be mental health cases?
Yeah, this could be a mental case. And that's why when these guys are taken to courts, you'll find that even the law, the magistrates, the judges, they will want to get a report, a mental case report. Most likely, these guys they are not themselves. And that's why sometimes when you take a mental assessment, when you do a mental assessment for these guys, you find that these guys are not normal. What is happening? They're under depression, or maybe they are working under the influence of some drugs.
Yeah. As I was also checking the WHO mental health statistics, it came out that nearly 1 in 7 people in the world live with mental health disorder. Nearly 1 in 7 people. So just count 1, 2, 3, 4, 5, 6, 7. At least one is having a mental health issue. And sometimes I feel there is stigma surrounding mental health issues. Can you maybe address the stigma and help people come out to ask for help?
Yeah, it is true. You see, sometimes we have people who are having mental issues, but in some families you find that these guys are locked in a particular house. They don't want people to know that they're having a mental case in a particular family. So I think my advice could be that if you are having a mental case in your family, you need to take this case out so that you can be helped. Because if you have a mental case and you take it to the hospital, there is where you get the help that is needed. So all these mental cases that we have, when you have any case at home, we have rehabilitation centers. You can take somebody there. Somebody can, if it's under, maybe he was working under influence of drugs, this person will be rehabilitated, will become a normal person. If it's a mental case that needs to be taken to the hospital for management, then we need to take these guys to the hospital for management.
And Daktari, you are not from outside this continent. We are African, and Africans possibly is our business.
Yes.
What is the major cause of stigmatization na watu kuficha au wagonjwa wa akili wanaficha mpaka wanafungia kwa nyumba, and I think this is going to worsen the situation because the moment mtu anajua nikishikwa naenda kufungiwa kwa nyumba, nienda nikae peke yangu, they become even more violent, they want to run away. From cultural context, kwa nini hawa watu wanapenda kufichwa sana kwa familia specifically?
Okay, maybe it will depend. It will vary from one culture to another culture, from one community to another community. But generally, people tend to hide these guys in a particular house, in a particular room, because they think this guy will be. Some people will look at them as if that the people who are producing people with mental health. So they want now to hide behind the table so that nobody knows that they are having a problem in their family. Because maybe somebody says some people think it's a familial thing. So if you have a mental case in your family, some people, they think some people will associate it with that particular family. So that's why some people would want to hide these people so that they are not known.
So they want to look normal, but while inside they are suffering.
Yes.
Could we also say that these people who hide people with mental health issues are also mental health issues themselves?
Yes, because if you are hiding a mental case, it means you are also affected. You see, the moment you are affected, you are infected. So this guy is also affected and is infected.
So the easiest way, what could you give the advice to these people? Because I know some of these mental health issues are very treatable, but the moment they keep them, they deteriorate. Because I know mental health, the brain has a way of receiving transmitters and stimulus. The more they keep recurring, the more the permanent it shapes. And if a person now takes longer before getting medication because of you want to hide, you want to protect the dignity of the family, you don't want your family to be on the limelight of a family that has mental health issues. How can we help these people to bring these cases out in good times to prevent the further deterioration?
Okay, thank you so much. What we normally say is that the earlier the better. If you discover that you are having a mental case in your family, it's better for you to bring it out very early, in early stages, because if you make a diagnosis early, before things get worse, we are able to treat most of these particular mental cases. But if you stay with this case at home, you are hiding it, and then it takes time. It's like it becomes like cancer. It's spreading to all body organs. So when it has spread, then it will be very difficult for us to be able to manage this kind of cases. So my advice is that if you are having any case in your family, in the community, make sure that this case is brought out to the facility where it can be managed.
Yes. I think in early diagnosis, there is a remedy, there is a reverse that can be done to this person to become more productive. So, daktari, maybe help this person, because sometimes people think that mental health ni uchawi. That's why utaona instead of going to hospital, wanaenda kwa waganga, wanaambia sijui huyu alikuroga, huyu amekufanyia nini. Then they run away from the reality when the issue is a mental health issue. It can be diagnosed and be treated conventionally. Help these people in 5 ways how you can diagnose mental health issues at home and not now. From the look of things, the way this person is behaving, this person needs some medical help. So it's also stigmatizing. But now, how can we identify these cases? Maybe you can give us the behavior that you can look at to identify this person is now becoming a mental case.
Yes. As I had said earlier, we have signs and symptoms that we can look at so that we can be able to identify these people in the community. If somebody we suspect is having a mental case, as I had said earlier, these people will try to isolate themselves. If you see somebody who is threatening people in the community with a panga, with a knife, I will kill you, I'll do something bad to you. Mm-hmm. These are people you suspect this person is actually not normal. Mm-hmm. And sometimes if you see these people, if you see somebody who is maybe somebody was talkative, then it just becomes cool and it's not able to talk. And sometimes it can be the reverse. Somebody has been talking a lot, has not been talking, but now started talking a lot. Maybe somebody has not been taking drugs. And then you find somebody now tries to start taking drugs. These are people now you're just suspecting there's something wrong that is happening.
Bible says that my people perish for the lack of knowledge.
Yes.
So if you can give us more, a range of them, so that when you're with somebody, mtoto kwa anaongeanga siku hizi anaongea mingi, there could be a problem. You can identify that as a problem. It's not a positive indicator. Ama huyu mtoto amekuanga anaongea sana, anatembelea watu, but nowadays they are so reserved. They don't know how to go out to people. Then you should start also questioning and start coming down to the roots to understand what these matters are. Ama mtu hakuwa anakunywa pombe, unaweza kukutana naye asubuhi amelewa.
Yes, true.
Yes, so maybe you can give us some more.
Also, you see, there are some people who are saying they're not violent. Then they all of a sudden they become very violent. So these are the kind of people you will now start thinking this person is not normal. There is something that is disturbing this particular person.
Ndio mtu anaweza kufika barabara, anaweza kutoa manguo. There are so many ignored behaviors.
Yes.
Yes. Maybe the early warning signs you have given us. A person start with the drawing.
Yes.
Those are early stages. But now before the mtu anaweza kufika kutoa manguo na kutembea kwa soko, ametoka nyumbani, what could be the early stages?
Early stages, you'll find that this guy is even to eat. They can set even hunger strike. They don't want to eat. So you'll find yourself, why are you not eating? They're not sick. They're not eating. So from there, you know that this guy has a case to answer.
Kuna siku okay, it's not good to laugh. Mama alikuwa anapika chai na akachukua chumvi akaweka chai ya maziwa. Could also this be indicator that something is now start going astray somewhere?
Very true. You cannot even be able to know that this is what I need to leave behind and this is what I need to remove. So they cannot be able to identify that this is tea. Now I need to use sugar.
Our dear viewers, it's a real concern. Today I was also in another conversation, and it came out that there are active cases that I don't want to mention because they are in courts. Men are killing women. And now it's like men are fighting women. What could be the major cause of such like a thing? Because you look at in ancient lives, men used to respect women, they used to protect them, but today men are killing women. Could there be another thing that will have been done that is altering the thinking and mind of men?
I think it is true because if you look at the statistics, you'll find that that's what's happening on the ground. But I think what could be triggering this, like in the younger people, what is happening is use of drugs. Drugs is one of the issues that is affecting our people. So if you engage in drug abuse, you are using substances that are able to alter your thinking, to alter your mind, your brains. Then you are able to go home and you kill your wife. You go home, you kill your family, you kill your friends. These are people who are under influence of drugs. Okay, so if somebody is using drugs, they think they have everything they need. They have all the energy. They can do anything. They cannot respect anybody. So that's why you'll find that when these things happen, most of them they are under drugs influence.
Daktari, I want us to wind up.
Yes.
We shall pick up from these stages. Give us examples of mental health disorders. Just name them. We shall come to discuss and explain each because they are variant. There are some people who will go out and talk, others will be reserved, others will be violent. Can you give us any samples of mental health disorders?
Mental health disorders are many, but I'll just give a few. Stress. Stress is the one that most people know that, okay, so many people say, I have stress. Niko na stress, that's a mental issue. that stress you are having is a mental issue. Then after you have developed stress, then maybe after you sit with it for some time, then you will develop what you call depression. Depression now it is serious. It's more serious than stress. So depression now you can decide now to do very bad things. Okay. So after that, then we have what we call psychosis. Psychosis now, there's a person who is now the guys you see around walking naked. They have thrown away their clothes. They are now walking out, they're beating people, they're throwing stones at people's houses. That is psychosis. Then you have what we call schizophrenia. Schizophrenia is like now psychosis, but now it's also, these are now people advanced stage. These are people now who are now very violent, they can do very bad things to you. If they come across you, they will be able to beat you, they are throwing stones, they are also naked. Mm-hmm. I think that is a few examples of mental cases that we have around.
So, dear viewers, we are just rolling this out, but we want to let you mental health issues, they are real. Simple forgetting of information. You see somebody putting on different colors of socks or different shoes, that could be a mental health case. You have your phone in your hand, but you're looking for your phone. That's another mental health case. Forgetfulness. Every time you are under anxieties. We just want to bring this to your knowledge, and when we come up next time, we shall be looking at each individual type of mental health disorder, and we shall be discussing it. What could be the causes? How can you manage it? There are those that will not be managed by drugs, and I thank you because I want to thank you because your audience and listening to this level, it's going to be so impactful and change even how you see people around you. So thank you so much, dear viewers. If you have a comment, drop it in our comment box. We shall respond to it. Or if you have a case that you feel you want to share, we want to welcome you on this podium. Thank you so much. Until next time, see you. Daktari, thank you so much for creating time for this show.
Thank you so much
yes.
for inviting me here.
Yes, thank you so much.
Yes.
Let's know if you have questions. Until next time, see you.